Hello, welcome my bald bearded friends. In this video we're going to talk about medications that can cause hair loss, or rather drugs-induced hair loss. This is in no way, shape or form medical advice, nor do I advise to, stop any medications you receive from your doctor. By all means keep using that medication, but this video can set you thinking, and you can ask, of course, your doctor if there are any other medications instead of hair loss inducing medication for you to try. But by no way, shape or form this is medical advice, nor saying you should stop using your medication. By all means keep using medication. But this is more, again, general information, just to be aware of one not that one side effect not that often seen, but still it's possible to encounter. There are certain drugs which can contribute to excessive hair growth, even changing the color of hairs, but also hair loss. And the last one is, of course, what we're going to talk about today. In a previous video I talked about the stages of hair growth. I will link it in the cards above. And in that video I talked about the different phases, like the Anagen phase, the Telogen phase, all those phases of hair growth in which each stadium the hair grows stays the same, or the hair loss, the shedding phase, and then new growth occurs, and it's a growth circle. There are, however, drugs who interfere with this normal circle of scalp hair growth by, during the Anagen phase, which lasts between 2 and 7 years, that the hair grows, and during the Telogen phase we have a phase which lasts about 3 months, in which the hair rests, and then at the end of the Telogen phase we have a shedding phase, and then the hair will be replaced with new hairs. The hair cycle in short. And there are two different medications, two different types of medication-induced hair loss based on the Telogen phase and on the Anagen phase. On the Telogen phase, the Telogen, I'm gonna butcher this name, effluvium, is the most common form of drug-induced hair loss. It usually occurs within 2 to 4 months after starting a drug and medicine. And this condition causes the hair follicles, instead of growing, going into their resting phase and fall out too early. So you shorten the cycle in which the hairs will way quicker shed in the circle, and that leads to, of course, to hair loss. People with the Telogen effluvium, I will put it on screen because I really can't pronounce it, usually shed between 30 and 70% more than the normal 100 to 150 hairs a day. So you can imagine that it could be quite significant hair loss in a day. There's also Anagen effluvium hair loss, which is hair loss that occurs during the Anagen phase of the hair cycle. This is the active growing phase, and if you have this Anagen variant, it prevents the matrix cells which produce new hairs within the bulbus in the hair from dividing normally. This type of hair loss usually occurs within a few days to weeks after taking medication, and most often this is seen with chemotherapy for cancer. and is often a very severe variant in which people quite fast will lose a significant portion of their hairs, as well as not only on their head, but as well as the eyelashes, the eyebrows, and so on. Of course, the severity of the drug-induced hair loss depends on the type of drug used, as well as the dosage, as well as the sensitivity of the person for that drug. So it's quite hard to say the exact outcome of use of these drugs, but it can be quite severe, all the way from quite severe, of course, to barely noticeable, a couple hairs a day extra. There's a very long list of types of drugs that can cause hair loss, and again, you should definitely ask your doctor about it. This is just a list found on WebMD, I will link it below, in which stated the many different types of drugs that are thought of to cause hair loss. Alright, this includes, and again, if you're using one of these, you could ask your doctor to, explain, or perhaps, go ask your doctor what to do. But again, acne medication containing vitamin A, antibiotics and antifungal drugs, antidepressants, birth control pills, anti-clotting drugs, cholesterol lowering drugs, drugs that suppress the immune system, drugs that treat breast cancer or other cancers, epilepsy, epilepsy drugs, anticonvulsants, high blood pressure medication, anti-hypertensives, such as beta blockers, ACE inhibitors and diuretics, hormone replacement therapy, HRT, mood stabilizers, non-steroidal anti-inflammatory drugs, NSAIDs, Parkinson's disease drugs, steroids, thyroid medication, weight loss drugs. So there are quite a few, quite a lot medications which can cause drug-induced hair loss. Again, go ask, of course, your pharmacist and doctor about these medications and their side effects. When hair loss does occur from a drug you're taking, there is quite a good chance that the hair will grow back on its own after you stop taking that medication. If stopping the drug does not improve hair thinning or falling out, they may treat it with minoxidil, finasteride, all those kinds of drugs, Rogaine, all those kinds of medication to accelerate hair growth, slow hair loss. But the most important part is, of course, that you proactively talk about it with your pharmacist and your doctor, because of course it's your own body and you want to be as informed as possible. This will be, I think, a rather short video. I hope, how would I put it, it will help someone. I think it's quite interesting, of course, these kinds of subjects. Again, by no way, shape or form this is medical advice, so always consult your doctor, again, and your pharmacist. But this is just a bit of a guideline to know if you should consult your doctor about these subjects if you are afraid of hair loss and you're using such medication. I think it's very important for you all not only to watch this video, but proactively search on WebMD and such sites for their side effects, but also, of course, trust your doctor and your pharmacist for, well, it's their job. So, thank you all for watching. If you like these kinds of topics, I made a video about hair loss, all such kind of videos, so we'll will heartily recommend you to those videos. Have a nice day. Ciao.